landscape. And while we have a number of applications and mobile apps that do in fact interface with both patients and clinicians in the context of using, modifying, or providing data or information, they don't always fall within the definition of a mobile medical device. But if they do, depending upon the risk profile, which would then help define whether the device is a Class 1 device, and we spoke to that in the context of a medical device status system, or possibly a Class 2 or Class 3 medical device, there are in fact additional regulatory requirements than a mobile medical application manufacturer would need to consider. These types of requirements are consistent with a medical device manufacturer that is designing classic mechanical, electrical, medical device. And so while there are certainly specific software requirements and additional guidances that would need to be considered by manufacturers, once you understand the intended use of your product and match it against those applications within the guidance document to determine whether or not your product falls under the regulatory space or not, is the first most important step in determining then where does your product fall within the U.S. and in terms of the regulations applied to that. It's an important not only to understand the intended use, but also the risk profile for that. We know that there are, millions of smartphone users worldwide, and companies such as yourself are innovating in this space for improvement of overall health and access to healthcare specific applications. It is certainly the intention to be very clear that while understanding that this space has a great opportunity for manufacturers, we don't want to stifle innovation by applying too much regulation, and yet at the same time we need to also be cognizant of the risks associated, and those risks then do come through once the intended use is defined. What happens when that medical mobile application doesn't operate as it's intended or as it's specified? So what we have is a landscape which allows us then to manage not only intended use and risk in an area that says it's important to be able to assure that we have patient safety first and foremost in mind, and there's a number of ways that you all can help you in this area as well, not only for mobile medical applications, but across the entire sphere of e-health and m-health and interoperability in this space. So we are coming up very quickly on the end. I apologize for the time, but we do want to leave some time for questions and answers. At this point in time, I'm going to ask Anura and our moderator to accept questions, and we'll answer those questions for you.
Thanks for the insightful presentation, Anura and Laura. Let's quickly take up the questions now. I request you to read out the questions and their answers so that all our users may listen to your insights. Anura, are you able to see the questions?
Yes. Okay. So the first question is,